Welcome everyone to the Tobacco-Free RNAO webinar, Transforming Nursing Care, an Experiential Perspective on Incorporating Tobacco Intervention Education into Curriculum. My name is Nicole Jeffrey, and I am the Implementation Specialist for the Tobacco Intervention Initiative at RNAO, and I am going to be moderating today's webinar. RNAO is a professional association for nurses in Ontario and promotes excellence in nursing practice and advancing nurses' contribution to the healthcare system. RNAO has a signature program called the International Affairs and Best Practice Guidelines Center that develops, disseminates, implements, and evaluates clinical and healthy work environment best practice guidelines. The RNAO Tobacco Intervention Initiative is a part of this program. As a part of our Tobacco Intervention Initiative, we hold regular webinars to build capacity among nurses and other healthcare providers to implement and sustain best practices in regards to intervening with clients who use tobacco. Before we begin, I would like to remind everyone to please turn up your speakers. We ask that if you have any questions you would like to ask RNAO or the presenter, or if you have any logistical problems, to please type them into the Q&A box during the presentation, and just be mindful when you're typing in your questions who you're sending the question to, whether it's to all or to the presenter or to any of the individual panelists. The last 15 minutes of the webinar will be used to address these questions or comments. Also, just so that you are all aware, the webinar today will be recorded and archived on the tobaccofreernaO.ca website if you would like to come back and re-watch the webinar at a later time. And just in addition, these slides will be emailed out after the webinar along with an evaluation. The learning objectives for today's webinar are to learn about effective methods to integrate tobacco cessation education into nursing and health sciences curriculum, to explore areas of nursing and health science curriculum where tobacco cessation education can be incorporated, to gain a better understanding of how to deliver tobacco cessation content in a way that is meaningful to nurses and health science students, as well as to explore resources that can be used for professional development and education. For those of you who are new to our program or to our webinars, the focus of our program is the newly revised and published Best Practice Guideline Integrating Tobacco Interventions into Daily Practice. This is the third edition of the Best Practice Guideline that was developed by the Tobacco Intervention team and was published in June of this year. This guideline is the product of a rigorous systematic review and guideline development process, a process that our presenter today, Dr. Shelley Walker-Lee, co-chaired. Each of RNAO's guidelines includes recommendations for practice, education, and system organization and policy. While most of our webinars discuss the practice recommendations, however, based on requests from viewers and our personal experience when engaging with healthcare providers and discussing the fundamental knowledge base of tobacco interventions, it was decided that we needed to do a webinar based on the education recommendations. This point was further emphasized when the Tobacco Intervention Initiative attended the Ottawa Model for Smoking Cessation Conference that was held 2 weekends ago, where a takeaway message was that there is a lack of tobacco cessation education across healthcare curriculum in general. An important finding considering that tobacco is still the most preventable cause of morbidity and mortality in Canada, and tobacco use kills anywhere between 35,000 to 45,000 Canadians annually and costs the healthcare system billions of dollars each year. So what do we mean when we talk about education recommendations? So within the newly published guideline, we created 2 education recommendations. So the first recommendation, recommendation 5.1, reads, incorporate evidence-based content on tobacco interventions in healthcare professional education programs. And then I'm just included a link at the bottom of this slide. This slide is the direct link to the content that is comprised in the Nursing Faculty Education Guide. And this is a free resource if you click on the PDF, or it can be purchased on the rnao.ca website. But it includes lesson plans that were pre-created by a board of advisors that we put together to create this content. Also includes content that you can include into any curriculum that you're building. And this recommendation applies not only to academic settings, but to organizational settings as well, and really recommends that you include tobacco intervention education into any orientation programs that you have within your organizations, just about the different policies and practices that you're expecting your healthcare professionals to be delivering to the clients that come into the setting. Recommendation 5.2 is the second education recommendation in the guideline, and it reads, ensure delivery of tobacco intervention curriculum is facilitated by educators who are trained and skilled in the field of tobacco use interventions. So this is a general recommendation not only for tobacco intervention, but in education as a whole, in that you need to be knowledgeable about the skills that you're trying to come across to the people that you're providing education to. And then Shelley's going to be touching on this further throughout her presentation, but there's just two organizations at the bottom that provide additional tobacco intervention education. I also just wanted to point out that yesterday we published a new e-learning module on the rnao.ca e-learning site. So this e-learn, if you're familiar with the previous e-learn, nurses and other healthcare professionals helping clients to quit smoking, this new e-learn integrating tobacco interventions into daily practice is going to be replacing that e-learn module and aligns with the new best practice guideline recommendations that were put out in June. This is a free, approximately 1-hour e-learn module and can be used by all healthcare professionals and just provides the fundamental knowledge that healthcare providers need in order to engage and intervene with their clients who use tobacco. I would now like to introduce Dr. Shelley Walkerly. Dr. Shelley Walkerly is a primary healthcare nurse practitioner currently in practice with Dialogue Technologies, providing primary healthcare to clients on a digital platform. Dr. Walkerly has a nursing diploma from the Osler School of Nursing in Toronto, a Bachelor of Science in Nursing and Primary Healthcare Nurse Practitioner Certificate from York University, and Masters of Nursing and PhD from the University of Toronto. Her doctoral thesis explored the factors that hinder or facilitate the provision of smoking cessation interventions by registered nurses and nurse practitioners in primary care settings. She is Assistant Professor of Nursing in the Faculty of Health School of Nursing at York University in Toronto. Welcome, Dr. Walkerly. We are thrilled to have you here today. I will now turn it over to you to start your presentation.
Thanks very much, Nicole. Can you confirm that you can hear me okay?
Yep, we can hear you fine, Shelley.
Welcome, everyone, and thanks so much for signing up and participating today. This is a really great opportunity for me as a practitioner in tobacco cessation, as well as an academic and researchers, to talk to people who are interested in how we can improve and increase the amount of tobacco cessation intervention education that we're providing to nurses and to other healthcare providers across the province. As you can see here, this is just my agenda for today. Part of this will be me presenting you information from some of the evidence that we looked at when we were creating the new revised guidelines. Some of it will be from my own research, and a lot of it will be from my own experience as a clinician and as an academic. And I'm hoping that at the end we'll be able to have questions and answers and some discussions about your thoughts on how smoking cessation interventions can be more fully integrated into curriculum. I wanted to touch on the evidence-based methods for delivering tobacco intervention curriculum. So we talk about what programs have been successful, the kind of content that would be useful, and some of the strategies. And also talk about the sort of dose of education that's required, the hours or duration of training, and what the outcomes look like. I want to talk about areas in education, in nursing education, health services education, continuing education and orientation, where tobacco interventions can be integrated. And I wanted to, at the end, we will look at some very available and local resources for faculty, for students, for professionals, and for staff in terms of education around tobacco cessation interventions. We'll begin with looking at some effective methods. So this information that I'm going to present here comes from the studies that we looked at as a group when we were developing the new guidelines. We found that there was quite a lot of articles that addressed in-person education. So these would be more didactic, the classroom approach, or webinars would, I think, count as well because there's more face-to-face opportunities. The researchers that we see listed here found that when people participated in in-person education, they were more likely to educate and treat clients and to feel that they were prepared to do so, more so than others of their colleagues that hadn't had any education. They also found that there were significant improvements in motivation, knowledge, and confidence. I think, you know, this intuitively we would see this as, you know, being borne out by our own experiences. My first experience of tobacco cessation intervention was in 2005, and in those days there was a lot of money from the ministry to make sure that healthcare professionals in the province of Ontario were well trained in terms of addressing tobacco use in our clients. And so I was sent, and me and many others, there were a lot of us in the province who were trained at the University of Massachusetts in a one-week program that was very well established there and had a really solid and sound curriculum. It was a great experience. And something like that really sent me back to my own practice, feeling that I was ready to be able to not just educate and treat clients, but that I could be a resource for my, you know, my colleagues in my own practice. So there's something to be said for that, that approach. Now, these days, we're using the internet a lot more often and more efficiently, I think, and certainly at a great cost saving. So there is certainly benefit in programs like the RNAO is doing and like I'm doing today that provide us a chance to interact around this topic. Online programs, and this is certainly what Nicole was talking about with the new program that was just launched at RNAO. Online programs have been shown to develop the knowledge and skill base to deliver effective cessation intervention and have been studied quite widely. RNAO has been doing this for a long time, as have a number of other organizations, providing people with an approach to learning about tobacco cessation at their own pace and with a variety of resources available online. The simulation or standardized client training, where this is feasible, this can be really helpful, and this has been something I've been able to employ in my own classrooms when I've had the opportunity. And I think for those of us who feel that we're somewhat new to this kind of work, or we feel we aren't especially well prepared to provide smoking cessation for clients, or we feel that we've done it, but we hit roadblocks with clients. We address the issue and meet with that person who just says, well, I'm not interested. I really don't want to quit, and you know, I don't want to hear what you have to tell me. And that's where we can feel like we failed and we're not very interested in going further or even taking on another client who might respond the same way. That's where I think being able to use standardized client training or simulation can be really helpful, because it gives us a chance in a safe environment to practice different approaches, to try some different ways of speaking to people that might produce a different response. I mean, the downfall to this, or not the downfall, but the negative side of simulation and standardized client training can be the cost, because people who are trained in doing this kind of work are fairly expensive, so we may not always have programs that can provide that. But I have been able to integrate it to a small degree in my own classrooms. One of the resources that we'll talk about at the end that would be very helpful for you, and I think we've built that into the lesson plans that are in the document that Nicole provided the link for on the front. One of the ways to do that is to use role play approaches from scripts that are developed by experts in the field. So the TEACH program that we'll talk about at the end that comes out of CAMH Teach provides a number of scripts and situations that you can develop a role play around that in the beginning, and I've done this in my own classrooms, in the beginning doesn't necessarily have to do with tobacco cessation. It may have to do with any behavior. So it gives people a chance to practice different roles, to see what it's like to be the client, see what it's like to be the nurse or the professional in that situation. So I think these can be terrifically helpful ways to provide this training, but again, you need the resources, you need the time, and you need somebody who can assist with it. It does certainly, we've been able to see in the studies, it does increase providers' confidence to provide advising and assisting in smoking cessation for their clients. Self-directed programs have been shown to be universally positive on knowledge, attitudes, and intentions. There's a variety of these in the internet environment. Some of the companies that produce nicotine replacement and other smoking cessation pharmacology have these types of courses online, and we're going to look at a few of them at the end. But they can be very helpful, but again, they require the person to be invested and have the time and the, a strong learning objective. And then there's a number of combination approaches. So for combination approaches might be part didactic and part role play. It might be part online and then coming together for discussion. In our own program, in the nurse practitioner program here in Ontario, we use a hybrid model. So students in our own curriculum have access to case studies. They have access to some role play. They have access to different approaches to motivational interviewing and brief solution-focused approaches. So all of that combination together hopefully helps someone develop some confidence in being able to approach this kind of work in their own practice. I think when we talk about all these different approaches and the fact that generally any of them can be effective, what we're going to do as professionals or as academics or as faculty, we're going to decide what level of training we need to be able to deliver the educational material, and we're going to decide what level of education or training our students or our target audience is going to need. Some people may need very brief approach, and it could be done in a self-directed way. Some may need more intensity, depending on what the goal of their training would be. If you're preparing people to go into the field to actually deliver smoking cessation or tobacco cessation interventions, they're going to need more intensive training than someone who's going to be offering brief approaches, brief advice. But all of these approaches are available to us. The other, and I just wanted to mention, this one is in our guidelines. We talk about this in the guidelines, and I wanted to talk a little bit about this particular study that's indicated here. This is Dr. Jenny Heath at Georgetown University in Washington. She and her team developed a program in their acute care nurse practitioner curriculum that had them utilize their advanced practice faculty, so the nurse practitioners who were faculty in the acute care NP program actually provided the training in a train-the-trainer model. So they would train the students, and then the students would train others. And it's a great article to read. It's a very effective way to increase confidence in people as far as being educators or people who are actually going to practice in the field. What Dr. Heath and her colleagues did at Georgetown was they developed a smoking cessation program within the School of Nursing at the university. So if students in the nursing faculty or from any of the faculties at Georgetown were interested in smoking cessation, they could come to this clinic. They would be seen by advanced practice nurses, both faculty who were acute care NPs themselves, or with students who were training to be acute care NPs. So a very effective model, and one that, you know, we might want to think about, some of us who are going to find ourselves fairly soon working in universities that are smoke-free. I was just looking at an early list the other day, and there's over 10 universities across Canada that are now smoke-free, and if you look across North America, it's becoming a more and more popular trend. I think McMaster went smoke-free, and I think Western's thinking about that. So this is something we're going to be, as educators, we're going to be dealing with. If you're working in student health services in a university or a college, or if you're working as faculty, these are going to become you know, opportunities for us to develop programs that will help our students who are using tobacco and would like to quit. So that would be certainly a model to turn to if you're looking at that kind of thing through your faculty or your health services. That article by Jenny Heath and her group is very interesting. So if we're going to provide the training courses, we have some ideas about what training courses might be useful, whether we do in person or we do in a didactic role, we do it online, we do it through modules, we do it in a classroom. How much training is really necessary? And again, it really depends on the purpose of the training. When we looked at the literature for the guidelines, here's some of the things that we found. In one particular study by McRobbie and his group, this was a 40-minute training session on treatment options and referral skills for general practitioners. They were wanting the GPs to initiate a discussion around tobacco cessation with clients and then refer them to specialized cessation services. So they found that even after a 40-minute training session, the GPs did increase the number of referrals to the cessation program. So something as brief as 40 minutes can make a significant change. Another study looked at GPs who took a 1-hour training program around what we would call more of a brief intervention for tobacco. That would just be advising people, asking people about their tobacco use, which is something, you know, that everybody in the organization can do, asking about their use and then advising them about tobacco use. And as little as a 1-hour training program there produced significantly more consistency in those people who had been trained in terms of asking and advising clients about tobacco use. A one-day didactic session that included role-playing, or what we might call simulation, facilitated short and long-term changes in healthcare practitioners' attitudes and behaviors around tobacco cessation. And any of you who, I don't know if any of you online have done some courses, certainly RNAO has provided lots of online, and they've got the Champion networks, but also if the TEACH program, TEACH when it first started at CMHA, you could go for as long as a week, so they were really replicating what had been the University of Massachusetts program from the early 2000s. And then over time that has shortened down to the point where now those of us who've done the trainer program at TEACH can go out to organizations and do a one-day didactic, much like this study described. And we can see that, and in this study, they looked at not just whether they were really, you know, had improved their practice for 3 months, but they were able to show that they improved their practice over a much longer period of time with just a one-day program, which, you know, isn't a huge investment. Borelli and their group looked at a pre-test and 6-month post-test for nurses who had spent time in a 1-hour training session for tobacco cessation counseling, and found that the nurses who had attended, even after 6 months, the benefit of that 1-hour training session was still demonstrated in their increased amount of counseling for clients. Then there is evidence that in very intensive programs, what we would call more than 4 hours, so we would, this would be more like that one-day didactic, can positively impact clinical practice. So this is what we would probably be looking at recommending for people who want to actually practice on a regular basis in their clinical areas and in providing tobacco cessation interventions. These more intensive programs certainly positively impacted clinical practice, and down the road, people found that it served as a model for all kinds of knowledge exchange initiatives, not just necessarily tobacco cessation, but other behavioral changes and other practice implementations. So we've got some idea about some of the ways, some of the types of programs, either the faculty who, guidelines would tell us, or, research would tell us, the more experience in education, the faculty member who's providing smoking cessation education has, the more impact their training will have. So we have programs that would help faculty to prepare as educators, but we also have other options that would prepare people at all different levels in educational organizations, in healthcare organizations, and beyond. So I just wanted to talk about some places where I think in curriculum, whether it's at the university level, at the college level, or in continuing education, where we can integrate tobacco cessation education. The undergraduates are so obvious, and you can really integrate it in every area of their curriculum. So pathophysiology, the harms of tobacco use. We sort of think everybody knows that, but they really don't. We've got a lot of studies that show that with surveys of even healthcare providers, people are limited in their understanding of tobacco use. They think, I have encountered people who believe it's exaggerated, that it's not as bad, and certainly lots of stuff in our culture would cause people to be confused about whether smoking is really as bad as we say or not, given the fact that tobacco is still available to people. So it's really important, I think, from the outset for people to understand the harms of tobacco use, as well as the benefits of cessation. Benefits of cessation really can be motivators not just for the educator or for the person who's doing the training, but it's something you can take to clinical practice, because many patients don't really may not see the actual benefits of cessation until they're encountering them. Another area I think that's very important in pathophysiology for undergrads is the discussion of addiction and what is addiction versus habitual use. We talk about this a lot in tobacco cessation work, that, and we hear the other side of it. It's very difficult. Some people don't like working with clients who are using tobacco because they feel like they've made a choice and that they don't want to change their behaviors because for all sorts of reasons. Yes, picking up tobacco, starting to use tobacco is an active choice that someone could make, but they're making it in the face of, the onslaught of the tobacco companies who have an arsenal that's larger than anything we'll ever have. They live in a culture that in many ways supports tobacco use. They see it in films, they see it on television, on and on. Certainly the environment is better now. We've done lots better work in creating an environment where tobacco use is not normalized to the degree it was. But I think once somebody is addicted to tobacco, it stops being a clear choice. The next choice they can exercise is a choice to address their addiction, and that's a difficult choice because it's a choice to voluntarily be uncomfortable, and that's not a choice that any of us make very easily. So understanding addiction. And addiction to nicotine in particular. If we think about other addictive substances, alcohol is a good one to talk about because we know alcohol is an addictive substance. We know that we encounter the ill effects of alcohol addiction in our culture in all walks of our own lives. We meet clients, we have family members who are affected by addiction to alcohol. But not everybody who drinks becomes addicted to alcohol. In fact, the vast majority of us who may use alcohol on occasion do not become addicted. That's not true with tobacco. the vast majority of people who complete even one pack, even 20 cigarettes, will find themselves with an addiction to nicotine. And that's really what we're addressing when we address smoking cessation interventions. So very important, I think, for undergrads to understand those concepts as they go forward. Certainly in health assessment, we know there's a great deal to be gained in simply asking people about tobacco use. They expect us to, as health professionals. When we don't, we're sending an unspoken message that it really doesn't matter whether you smoke or not. It's not as bad as people say. If it was bad, my doctor or my nurse practitioner or my physio would ask about it. And they didn't ask, so it's probably not so bad. Trust me, when smokers are coming to see you for health care, when students are coming to see you, they're coming with the idea that if they're smoking, you're going to talk about it. And when you don't, you're giving implicit permission to continue. So very important to teach undergrads at every level about health assessment, in the health assessment, about asking about tobacco use, and then being able to assess for the effects of tobacco use. Pharmacology, very important. I think, you know, a lot of clients, and certainly I think a lot of providers as well, have the idea that nicotine replacement is kind of magic. Once I put the patch on or start taking the medication, I'm going to magically not want to smoke anymore, and that's not the case. The purpose of pharmacology, I think this is really important to embed in curriculum. Purpose of the pharmacology is to manage cravings. People smoke because they have cravings. And because of the nature of nicotine and its short time in the bloodstream and its short time in the brain, the highs and lows, the troughs and hillocks are very close together, which is why we see people having to smoke, you know, every hour, every half hour, because the dip in their blood and brain concentrations of nicotine and the endorphins and other neurotransmitters that are involved in that whole process really, you know, are the whole reason behind smoking and the whole reason behind the pharmacology to address it. What we're doing with nicotine replacement and with the other pharmaceuticals as well is to help people manage cravings for nicotine. I often, you know, and I'm sure all of you have had this experience as well, people will say, I can't imagine quitting smoking because it feels so good. I love it so much. What they love, what feels good, is addressing the craving. It's not that nicotine necessarily, in fact, we know from, you know, lots of research that nicotine doesn't address anxiety. It's not an anti-anxiolytic. If anything, it causes anxiety, causes agitation. The anxiety that people feel tobacco or nicotine is addressing is the anxiety that's the result of their craving. So really all nicotine does, all smoking does, is deal with your cravings. So it makes sense to take away a harmful form of nicotine and replace it with a non-harmful form. I think any of you who have been familiar with or have done tobacco training in the past or have looked maybe at the first and now the second and third iteration of these guidelines will know that things have changed quite a lot in what we're recommending to people, and I think that's why the pharmacology is really important. RNs, pharmacists, all sorts of health providers are certainly in a position to be able to recommend nicotine replacement products, and I think it's really important for our students and our staff and anybody who's doing this work to understand how that pharmacology works and what the purpose of it is. So that would be a big area, I think, where we can introduce cessation education. The professional roles and responsibilities, these are large. Nursing roles for advocacy around smoke-free environments, support for smokers to quit, those kinds of issues. We can show leadership in health policy, in our own organizational policies, and we can provide education, not just to clients, but to others. And I think one of the other places where we might not think we can introduce smoking cessation education, but we ought to, is in the field of ethics. We all have ethics courses in our undergrad and our graduate programs, and these are very important conversations, I think, for us to have as educators and for our students to have, and those of us who are providing care within organizations and institutions need to have these ethical discussions as well. there's all kinds of issues around individual choice and freedom versus addiction. There's great discussions to be had around harm reduction. There's some significant feminist perspectives on tobacco control. My colleague Annette Schultz, who has been a leader in tobacco cessation across Canada for a number of years and was certainly a very important member of our team as we wrote these guidelines, has written some excellent material about how women are perceived as smokers and women's responsibilities for the health of others, and sometimes to the detriment of their own, and some very interesting conversations could be had there. And the ethics about access to treatment. If people want to quit, they really do need access to all of the supports that are available to them, and that's not necessarily possible for everyone. For our graduate education, obviously our people in graduate education for clinical nurse specialists, nurse practitioners, cessation interventions are key, but also all of those other things we talked about in the undergrads. For those folks who are in the leadership programs in graduate education, this is where curriculum, developing curriculum, building on the work that we've already done and others have done around the specifics of curriculum in tobacco cessation, and then what's required for faculty training. We have very little research into this. We know that when faculty have training, the outcomes in terms of student outcomes are better, but there's a big area there for us to study in terms of what kind of faculty education is actually required. And then our students who are doing a leadership arm in graduate education, their role as advocates and for social and organizational strategies. There's, a concrete example would be working in a smoke-free hospital. If you're in a leadership position as a nurse or other healthcare professional in one of those organizations, there's so much work to be done in terms of educating and supporting staff so that staff can educate and support clients in a very positive environment rather than an environment that's fraught with a lot of discord and discomfort. And then those students doing research. There is so much research we could continue to do in tobacco and other addictions. We know we're in a culture right now that's really facing many challenges around addictive substances. So research around addictions, behavioral interventions, counseling, more about pharmacotherapeutics, on and on it goes. The other thing I hadn't put here, well, I talked about youth, which is a particular area because, well, we have seen a very substantial decline in the number of active smokers in Canada, Ontario leading the way in many cases. We know that we have a large cohort of young smokers, and our goal for that group is to either prevent them from ever starting or to help them to quit sooner. Our ultimate goal would be to not have another generation of lifetime smokers who have to suffer the consequences of tobacco later in their lives. The determinants of health are very important. People who lack access to resource are not in a position to quit as easily as those who have more resources. There's been quite a lot of literature produced around the ethics, again, of addressing tobacco use among people for whom tobacco may be the only thing in their lives they can make a choice about. It may be the only thing they have that actually makes them feel better. So when you take that away, what are you replacing it with? There's been a lot of good discussion and good writing around that. So I think it's an area that's certainly open to more research and more discussion. And this will lead us into a short discussion of the other folks we work with in whether we're an educational organization or healthcare organizations who we need to think about in terms of orientation and continuing education as well. The no wrong door approach is not new to tobacco. We're borrowing that. That's been used in public health services and community health services for a long time. The idea being that every client, everyone the client encounters as they walk into your organization, whether you're in a hospital, you're in a primary care clinic, or you're in even in a university, should be able to provide you with some level of tobacco cessation, even if all they know is, I know where the clinic is, I know where the people are who can help you. So this, we go from the person at reception right the way through the organization. Tobacco use affects all aspects of a person's life, and providing universal access to services and support increases the likelihood of cessation. This has been demonstrated in many of the organizations now who have used the Ottawa model and followed and become smoke-free organizations. So I think that's a good approach for us to adopt when we think about our roles. Regardless of who we are in the organization, we all have the capacity to be role models, to be advocates, and to be collaborators in creating healthcare and education environments that are tobacco-free and support our colleagues, our staff, students, and clients who want to change their behavior. Having said that, in healthcare environments, this is something I've practiced in my own clinic. Where I worked, we took this approach, the no wrong door approach, and many other organizations have done the same. So everyone from reception through to the executive director has some level of smoking cessation education, so that regardless of what program the client is involved in or who the client is talking to in the clinic, they can always get some help and direction around tobacco cessation if that is their goal. We would certainly extend that to PSWs. Our PSWs, whether they're working in long-term care, which are those organizations now that are dealing with the concerns around no smoking and personal choice for people who are aged. So PSWs need not just to be able to talk to people about quitting, but need to have a chance to talk about the challenges they face as frontline workers in organizations that have gone smoke-free, where we have clients who may not be comfortable with that. Same for home care. If they're going into people's homes, their health is at risk if they're exposed to secondhand smoke on a regular basis. How can they be a positive mentor and guide for their clients in the home care setting to reduce their tobacco use? And this is why all of these people need, to have some information at hand about the use of nicotine replacement and other products that, again, are to manage the cravings that come when we embark on a cessation experience. Our security folks, we have security people who have a responsibility to make sure that the bylaws are followed, so that people aren't smoking within the 9 meters. And in some hospitals and organizations, they've even increased that distance away from the actual physical plant. I think it would be important that those security personnel also have tobacco cessation education and ideas for how they can offer help to people rather than just be enforcers. Your information, staff at your information desks, and a whole range of healthcare professionals. People who smoke live in the world and encounter healthcare professionals in all sorts of places, and smoking affects our lives in all realms of it. So all of these folks really would benefit from some level of smoking cessation education, whether they're physios, OTs, massage therapists. The dentists and dental hygienists have done a lot of work around smoking cessation in their own practices, and we are starting to see that come into the environment. Educational environments, it's everybody, whether it's faculty. Faculty need to be looking at their own curriculum and curriculum development and where they can introduce smoking cessation curriculum and support it among their students. Certainly there may be ways for us to help our preceptors, our clinical preceptors, the folks in the field that our students are working with. If there's ways that we can help them improve their knowledge and capacity to provide tobacco cessation education, that would be very helpful and a good role model for our students. Clinical education and leadership experts, again, so they can integrate this into curriculum. Student services, all student health services interacts with students who smoke all the time, and I know that you have supports and there's leave the pack behind and things like that within the organizations. But I think as we start to see more and more universities considering becoming smoke-free campuses, I think it's going to fall to student health services to be able to become strong advocates and strong support for students as they start to engage in that kind of environment. Student associations need to support Leave the Pack Behind and other initiatives, and student mental health services, I think, as well. That would be a place where I would target curriculum or education for that group of personnel. So at we'll come to the end. Boy, that went fast. Here are some and these are all contained in the guidelines, but I reproduced them here, so you'll have them in your slides. But here are a number of very accessible and local resources that provide a full level, all the levels of smoking cessation education. They employ all of the approaches that we looked at in the first few slides, and most of them are very affordable. So these would be good things for faculty who feel that they need more education themselves in order to integrate cessation into their curriculum. It would be great for staff. It would be great for people who are responsible for orientation and continuing education, or maybe something that organizations want to utilize for their own staff. So I'll go back, sorry. So RNAO has a number of, there's workshops, webinars, and e-learning courses all directed at helping educate healthcare providers about smoking cessation best practice and interventions, and there's both the websites. PTCC, they've been around forever. They're a very strong resource center for Smoke-Free Ontario strategy. They provide training and technical assistance to healthcare providers working in tobacco control in Ontario with workshops, webinars, and resources, and they work very closely with the local tobacco control networks in the province and through the health units. The Canadian Mental Health Association offers interactive workshops on principles, skills, and methods for motivational interviewing, this is the kind of thing for people in the field who are doing tobacco cessation work and want to improve their skills in motivational interviewing as an intervention. And then the Center for Addiction and Mental Health, this is where the TEACH program was initiated, and it's still running, and they're still doing the research. They also are responsible for the STOP study, which is providing free nicotine replacement to thousands of people in the province over the last many years in an effort to increase the number of people who are able to quit using tobacco. So we have a few minutes left for questions. Oh, wait, I forgot. The Ontario Tobacco Research Unit. This is just as it says. They do a lot of the research around tobacco control monitoring in the province, and they do provide an excellent course very intensive course on tobacco control for those who are interested in something at that level. And then the You Can Make It Happen is a comprehensive source of information, tools, and resources about tobacco cessation for healthcare providers, provided by public health units and the Smokers Helpline. It's an excellent website, lots of information there. They provide links to training opportunities, brief contact interventions, intensive interventions, and motivational interviewing. So let's go to questions.
So thank you, Dr. Walkerly. That was an excellent presentation. We have a couple questions for you here. So the first question posed was, do smoking cessation methods differ in mental health?
That's an excellent question. The issue of mental health is a complex one. We know now, and I don't think we always did, I know we didn't always know, but we know now that there actually is a benefit for people with some psychiatric diagnoses like schizophrenia. Tobacco, nicotine itself helps somewhat with the gating response, so that people who are using tobacco are often using it as a form of self-medication rather than just attending to cravings. At the same time, people with those types of diagnoses are, because of the common medications used to treat them, are often at much higher risk for cardiovascular complications. So it's kind of, you know, we're you know, putting them at risk from both, from tobacco use and from the medication used to treat them. There was a lot of controversy, and there still remains lots of issues around psychiatric facilities being smoke-free and how to support people in those facilities when they're when they're in residence and want to smoke but aren't able to. I think that while there are different issues around tobacco use in mental health, I think the same principles apply. You need to understand the medications and nicotine replacement in particular as a way of managing cravings, because cravings are the things that cause the discomfort. So just like we would manage pain in someone who's having chronic pain issues, we want to manage the cravings with medication as the most effective way we can. So it means supportive environments, full and easy access to all of the medications that they require in order to do that. Does that help the question? Is that answered?
We can give time for the person who asked the question to elaborate if she didn't feel like you did, but I think that covered the question very well. This question oh, she said yes, you did cover the question well. The next question is for, I would think, myself and for you, Shelley, and the question is, do you have online modules for people in healthcare environments, and is this part of their orientation as new employees? So I can speak to that from an RNAO perspective first, and then if you have anything to add on, Shelley, I'll ask you to please do so. So in regards to online modules for people in healthcare environments, I would recommend doing the online module that I said RNAO published yesterday, and you can find that on elearning.rnao.ca. It's a free 1-hour e-learning module, and it just goes over the fundamentals of what healthcare providers in any healthcare setting would need in order to initiate those conversations and provide brief intervention to clients. So this is sort of a foundational concept of brief intervention that can be used in any healthcare setting, and the title of that e-learn module is Integrating Tobacco Interventions into Daily Practice. And then we did have a webinar that I presented a few months ago that's archived on the tobacco-free-rnao.ca website, and it pertains specifically to integrating tobacco interventions into acute care settings. So that might be something that you'd want to look into as well. That's also a free resource, and it runs over about an hour. Shelley, was there anything else that you'd like to add in terms of online e-learn modules?
Well, I think, as you say, RNAO is a great source for those, as are some of those other resources. What we did in our organization when we decided that we wanted to make sure that more of the personnel who worked in the environment had smoking cessation education at a level that would be useful for them, we were able to find online programs that people could do on their own time. They could do it at their desk. They were fairly easy, and I think that's really important to be able to provide people with things that are not onerous. They can do them in a timely fashion. They're geared to what their goals are in terms of their level of involvement in tobacco cessation. And I just want to put a plug in here this is more of an inpatient issue, but again, I mentioned Annette Schultz, but one of Annette's early work was with registered nurses in hospitals in Western Canada, and the dichotomy and the struggles of being the person providing care, but also the person who's responsible for removing somebody's tobacco products and making sure they're not smoking while they're in hospital, and sort of becoming the tobacco police. And nurses felt so uncomfortable in that role. And I think as we've seen more and more organizations become smoke-free and more nurses, RPNs and RNs put in those positions of providing care and wanting people to be comfortable and have good experiences, but at the same time having to remove tobacco products and limit their access to them. One of the things I want to say in terms of what kind of education and should it be an orientation, 100%, everybody who comes into the organization needs just not oriented to the policies around tobacco use in the organization, but needs to have education to help them so they can help clients. And the nurses in Annette's study back then, that was one of the biggest findings, I think, was that they needed support. They could not just be given a small amount of education and a policy manual and told to go out and deal with clients. We need to give education to staff as support, and then we need experts there to help them when they have, you know, problems that they're not able to address.
Thank you, Shelley. And just sort of a follow-up to that question, wondering if you have any recommendations of modules for lay people, such as volunteers or reception, anything around that?
Well, I think there's things on the Smokers Helpline. I think where you might be able to find that would be at the You Can Make It Happen, because they have a lot of different levels there, and I think that there's things there that would be helpful for you know, for more of our lay personnel. I also think some of the hospitals who were early adopters of the Ottawa model and became smoke-free organizations, in some of those organizations they developed excellent orientation programs for security, information people, receptionists, medical secretaries, those personnel. And in fact, some of that may be available through the Ottawa model website.
Perfect. Thank you, Shelley. And I just have one general question for you. So for people who are on the line right now, educators or faculty, and if they don't currently have any tobacco cessation content integrated into their programs, what do you suggest as being a good starting point? I know curriculum sometimes can be difficult to change and can be a timely process. So where would you recommend just starting the journey off?
That's a great question. I think if it hasn't been integrated, you know, I have to say off the top, I would, pathophysiology, anatomy and physiology is an early course in most undergraduate programs. And I would start to introduce the whole notion of addiction and behaviors. And then I would move to health assessment. I think those are two good places to start. But even if you start at pathophysiology, you can build on it. When students get, you know, further into their programs and into pharmacology, it's easier to introduce curriculum material around tobacco cessation aids when they've had the patho beforehand. That would be my guess, but you know, there's experts in this area that would probably give much better advice. I would say have a look at the booklet, the free booklet that you highlighted at the beginning, the curriculum guide. We were a very similar committee. A lot of the same folks that worked on the guidelines, myself included, worked on developing that curriculum guide some years ago, and it is quite helpful and really will help you just to think about where to begin when you want to introduce it.
All right, thank you very much, Shelley. And that is all the time that we have today. So thank you very much for coming on and delivering that excellent presentation. And thank you to everyone who was able to sign on and participate in the webinar. Just want to let you all know that you'll be receiving an evaluation email within the next 24 hours. And like I mentioned at the beginning, this will also include the slide deck that was delivered today and information on how you can access the full presentation after the webinar if it's something that you would like to refer back to. And just so that you're all aware, we are also having a Healthy Work Environment webinar series that's going to be running from February 27th to April 3rd every Tuesday from 1 till 2:30, and there's the registration link for it there as well. So thank you, everybody, and thank you very much, Dr. Walkerly.